The socioeconomically disadvantaged in Australia experience the poorest health for almost every condition we know. To address these socioeconomic inequalities in health, myself and researchers at the Institute of Health and Ageing have developed a research program called IHA, which is the Australian Health Inequalities Research Program. The 5 components of the IHA program are, firstly, to monitor and survey the nature and extent of inequalities in Australia. How big is the problem? Is it getting worse? The second part of IHA program is about developing methods and measurement. How do we actually measure socioeconomic position? How do we collect data from people who are socioeconomically disadvantaged? The third part of the program is about how can we understand health inequalities. At the moment, we know they exist, and they've existed for many years. But what we really don't have a good understanding of are the reasons for these inequalities. That leads then naturally to the fourth part of the program, which is what can we do about it? Increasingly, researchers and policymakers are wanting to know how can we address the health gap in the Australian context between advantaged and disadvantaged groups. The fifth component of the IHA program is to strengthen our capacity to undertake this research, to build networks, to find ways of further developing this research program. Because in the Australian context, the study of socioeconomic inequalities in health is a reasonably small area, and so we're continually trying to find ways of growing the field. It's an important area. It speaks to issues of social justice and the common good, themes which are very consistent with ACU. And so the work program, IHA, fits very nicely with ACU's broader mission and goals.